Erin Neuenfeldt, and I'm going to be performing a cranial nerve examination on you. Can you confirm your name and age?
Jade Fit, age 21.
All right. Like I said, I'm going to be examining your cranial nerves, which supply nerves to your face and your neck. Is that going to be okay?
Mm-hmm.
Excellent.
Yes.
We'll begin with the optic nerve, and that's testing your vision. Okay? So first I'm going to begin with your visual acuity. Do you usually wear glasses?
No.
Okay. So if you could cover one eye with the palm of your hand, and starting at the top, I'd like you to read the letters as far down as you can go.
COHZVNSZDGVXY. That's all.
Okay. And with your other hand, again.
COHZVNSZNGG. That's
Excellent. Okay. Now I'd like to test your pupils. It involves shining a bright light into your eye. Is that going to be okay?
Yes.
Okay. So if you could just look at a point in the wall in front of you and just keep looking at that point. Excellent. This one. Awesome. And now I'd like to swing the light between your eyes. So keep looking at that point on the wall in front of you. Excellent, thank you. Finally, I'd like to assess the ability of your eyes to focus. So you're going to look at that point on the wall, and then you're going to look at the pen, kind of going cross-eyed, okay? Now look at the pen, look at the wall, and the pen. Excellent. Now I'm going to do some specific tests of your vision. Keep looking into my eyes, and then you're going to point at the finger that you see moving. Good. Excellent. Okay, down the line. Excellent. Now on to visual fields. I'd like to test your visual field, so if you could cover one eye with the palm of your hand, and then I'm going to cover the opposite, and let me know when you see my finger moving.
Now.
Good.
Now.
Okay, keep your palm there.
Now. Now.
Okay, now you switch your palm of your hand. Okay.
Now. Now.
Okay, you keep yours.
Now. Now.
Excellent. Okay, so now we're going to test your eye movement. This involves the ocular motor nerve, the trochlear nerve, the abducens nerve, and the trigeminal nerve. So are you experiencing any double vision at the time?
No.
Okay, so just keep your head still and then follow my finger with your eyes. Excellent. I'd now like to assess the sensations on your face. First, I'm going to use a cotton ball. So I'm just going to get up. This is what it's going to feel like. Do you feel that?
Mm-hmm.
Excellent. Okay. So let me know when you feel the cotton ball on your face. Close your eyes.
Now. 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 Now.
Excellent. Did it feel the same on both sides of your face?
Yes.
Okay, good. Now I'm going to test with this neuro tip. Okay? This is what it's going to feel like. Do you feel that?
Mm-hmm.
Excellent. Let me know when you feel it touching your face. Close your eyes again.
Now. 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 Now.
Excellent. All right, so now I'm going to feel around for some of the muscles in your face. So if you could just clench your jaw. Okay, relax. Clench your jaw. Relax. Good. Now, if you could open your mouth and don't let me close it. Excellent. Okay, now I'm going to assess your reflex. So relax your jaw down slightly like this. Good. Okay, I'm going to put my finger under your chin and just tap and test your reflex. Good. Okay, and now we're going to test your facial nerve. So that's just some of the movements of your facial expression. Can you raise your eyebrows for me? Good. Can you close your eyes as hard as you can? Okay, and don't let me open them. Good. Can you puff out your cheeks for me? Good. Now don't let me push them in. Good. Purse your lips for me. Good. Bite your teeth. Excellent. Now we're going to be checking out your vestibular cochlear nerve. So that's like your hearing. I'm going to place one hand on your ear and whisper something. Then I'm going to stand a little farther and whisper again, and you tell me what you hear.
17. 62.
Good. Other side.
41. 70.
Excellent. Okay, now onto your glossopharyngeal and vagus nerves. Open your mouth and say, ah. Good. Could you cough for me? Good. And then, could you take a sip of this water? Okay. And when you're ready, swallow. Excellent. Next, we're testing out your accessory nerve. So that's like the power of your shoulders and your neck. Shrug your shoulders for me. Good. Now don't let me push them down. Good. Okay. And now you're going to turn your head to the right, and don't let me push back. Turn your head to the right. Okay. And turn your head to the left. Don't let me move you. Good. Okay. And lastly, we're going to check your hypoglossal nerve. It's like your tongue. So just open your mouth at a resting point. See your tongue. Good. Now stick your tongue out for me. Good. And then press your tongue into my fingers. Good. Other side. Excellent. That completes my cranial nerve examination on patient Jade Vitt. I detected no abnormalities.